It's my great pleasure to be here this morning for this exciting occasion. And I want to congratulate, obviously, the graduates, Leslie and Kennedy, for their work. I want to congratulate the IRF for its support and its involvement in this exciting program and the training of rehabilitation medicine physicians in Ghana. This is indeed just an exciting morning, and for not only the graduates, but for the faculty from the IRF, the bidirectional participants in this program, their families, their institutions. I want to say how important this morning is and how pleased I am to be here. I just have a few short comments to make. I want to talk about, first of all, that this is the story of a continuing dream. More than 20 years ago, Andy and I was in Ghana, and I saw the people in the streets walking with their congenital disabilities and their traumatic disabilities. I saw young men who had, so many motor vehicle accidents that are traumatizing to young men. I saw children who were crippled by cerebral palsy, and I saw adults who were crippled by strokes. And one of my friends in Ghana, the legendary Professor Fred Tsai, I remember more than 20 years ago, his wife, who was also someone who I knew well, had a stroke, and he had to arrange to have two physical therapists flown in from the UK because there were not the kind of expert physical therapists to give her the kind of rehab that she needed. So this is really the story about a continuing dream that Andy and I talked about. I don't even know, Andy, more than 20 years ago, the possibility of building reproductive health or rehabilitation medicine, and not only in Ghana, but across sub-Saharan Africa. Again, more than 20 years ago, I was sitting in a meeting before the Ghana College of Physicians and Surgeons even existed. And it was a meeting for the celebration of some of the first graduates of the OBGYN training program. And it was in the presence of the president at that time, Flight Lieutenant Jerry Rawlings. And I was sitting next to somebody that Leslie knows well, Professor J.B. Wilson, who was a legendary professor of obst and gynae at the University of Ghana. And JB leaned over to me and he said, "The dream continues." And in OBGYN, more than 300 people now have trained in obstetrics and gynecology, and fellows now in maternal fetal medicine and GYN oncology and reproductive endocrinology and infertility, family planning, and family planning and reproductive health have been graduating. And actually, Kennedy and Leslie will both see the products of those trainees, because the children that are born prematurely that are burdened with cerebral palsy will be some of the patients that they see in their practice. So this is indeed a story of a continuing dream. And Andy, it won't be too many years before you'll have hundreds of rehabilitation medicine physicians and physical therapists and rehabilitation medicine experts across.
So maybe.
I want to just talk briefly about three words. I want to talk about resilience. And I want to congratulate Kennedy and Leslie for the resilience you've shown throughout your careers to go to medical school, to do your housemanship, to do your training in specialties, and then to pursue rehabilitation medicine, because I know that there have been barriers to you, and I commend you for your resilience and for the resilience of your families and the resilience of your friends that have made your careers possible. And I look forward to the resilience that you're going to show in the coming years. Much of what we as physicians, those of us who are lucky enough to be physicians, learn from is the resilience of our patients. And I know that the resilience of your patients have inspired you to further your careers in rehabilitation medicine. There are people on this on this Zoom call whose resilience have inspired us. And so it's not only your resilience as doctors, but the resilience of your patients that have inspired you and it's continued to inspire us and will inspire this program. But I want to encourage you to pay attention to the resilience of the relationship between you and your patients, because there are going to be days that are very, very difficult. When you see patients who are anxious and patients who are depressed and patients who don't feel that they can move forward, there'll be days when you feel that there's nothing more that you can do for individual patients. But it's that doctor-patient relationship that's so special. And I encourage you to nurture and embrace the resilience of the doctor-patient relationship, because the basis of what we do is based on this clinical paradigm and the importance of the partnership that we have with our patients. And so as you develop your careers in rehabilitation medicine, I encourage you to develop that partnership and the resilience that that partnership can give to you and inspire you as this program expands. The other two words that I wanted to bring up, in addition to resilience, are both words that will be important in your careers. One is strategy. I mean, obviously, there was a strategy that IRF had and that Andy Haig had to develop rehabilitation medicine in sub-Saharan Africa, in Ghana, and across the world. And that strategy is one that you guys embraced because you bought into this, right? You were the early adopters and the early embracers of the possibility that rehabilitation medicine can exist in Ghana when many people felt it wasn't possible. And so the importance of strategic thinking is very, very important for you. And Kennedy and Leslie, the strategy of, how can I advance my career? How can I support the Ghana College of Physicians and Surgeons? How can I support my institution? How can I support my patients? How can I find more wheelchairs for people? How can I find more clinics? How can I find more clinic capacity for the many, many people who need rehabilitation medicine and rehabilitation care in Ghana? Are important things for you to focus on. But one of the things that I've learned is that while you might have a strategy, the importance of embracing opportunity is also very important. Opportunities will arise. And we always knew that the IRF was an opportunity for the IRF to partner with Andy and with the team, the international faculty team that he's brought together. And so never underestimate the importance of paying attention to opportunities. Unexpected opportunities will arise. They'll arise in your clinic, they'll arise in your institution, they'll arise in your lives. And I encourage you to embrace the duality, often the conflicting duality of strategy and opportunity, and make sure that both of those inform your careers as you move forward. So today, it's my pleasure to be here. My message is to Andy and to the IRF and to Kennedy and to Leslie that this incredible dream is being celebrated today, and that 10 years from now, 20 years from now, 30 years from now, as there are hundreds of rehabilitation medicine doctors, not only in Ghana, but across Africa, and there becomes a Pan-African movement for rehabilitation medicine, that this dream will truly continue. And that as you continue your march along this dream, that you use both strategy and opportunities that present themselves to advance not only the mission of rehabilitation medicine, but the vision that we all have as doctors to do the best every day we can for our patients and for our communities and for our nations. So I can't tell you how excited I am to be here today. This is an exciting day. This is an invigorating day. And my congratulations to Andy and to his team. But today, especially, my congratulations to Leslie and Kennedy. It's really exciting to me that we have one a graduate from the University of Ghana Medical School and one from the Confagnoce University of Science and Technology, recognizing that this is not only a bidirectional program between many countries and Ghana, but in fact, it's a program that embraces a pan-Ghanaian view of where reproductive, I keep saying reproductive health because that's where I spend my time. And rehabilitation medicine starts with an RE. There aren't many other specialties that start with RE. But for rehabilitation medicine, this is in fact an exciting day because we have representatives from both the University of Ghana and the KNUST. And I look forward to the day when we welcome graduates from Cape Coast and UDS and UHAS and Family Health Medical School, as those graduates become the future of rehabilitation medicine in Ghana. So thank you for the opportunity to be here today, and congratulations to everyone, and especially to the graduates.